Rachel Hatfield with Mental Health Professionals Continuing Education, and I'm here today. We're going to talk about availability of treatment in this time and ways that someone might be able to find the appropriate treatment for them. Our guest today is Lindsey, and she's an associate marriage and family therapist in California, and we are going to be discussing finding the right therapist for you. So I'm going to turn it over to her, and we're going to hear from her for a moment.
Thank you, Rachel. I'm really excited to be here. So my name is Lindsey Cooper. I'm an associate marriage and family therapist in Westlake Village, California. I specialize in working with trauma using brain spotting, as well as exploring identity limiting beliefs and specifically LGBTQ identity and experience. I at a trauma treatment program as well, and then do a little bit of therapeutic coaching, which is different for me than in-person or telehealth therapy.
Okay, all right. So, how long have you been practicing?
I graduated a little over 3 years ago, so I've been in practice since then. And on top of doing the clinical work, you and I were chatting about different areas of how mental health professionals can work in this field of healthcare and wellness. And so I was also doing therapeutic placement. So I was visiting treatment centers throughout the country and evaluating who's going to be the most appropriate client for this place, so that when, families bring on a consultant, and at the time that was my role, we could really say, hey, this is why this specific program is going to be the best fit for you at this time, and navigate that process. So I was doing that as well as our individual sessions. I do some family therapy, and I used to work in comprehensive dialectical behavioral therapy.
Okay. Lots of interesting areas to work in for sure.
Yeah, I try to keep busy.
Yeah, me too. So, some of the things that we're going to talk about today are ways that someone that may be new to therapy can find a therapist, what type of services we still have available in our nation, and what might be the best routes of finding someone during this time.
Definitely. There's so much, and I think we're really lucky with the amount of resources we have for mental health support. And because of that, it is ridiculously overwhelming. And sometimes it's like, where do I even begin?
Right. Right. So what might be a way that someone can begin to find someone that they're looking for if they're trying to find a therapist, say for individual counseling?
My go-to, honestly, is to first try to ask your friends, because you can Google, and we'll get to, searching through the internet. There's so much information there. And what I found is when we ask somebody that we know, and that maybe a friend of ours, somebody that we care about, somebody that knows us, if they've got a referral for somebody, or they've been working with somebody, even if you don't go and see, your best friend's therapist, you can call them and say, hey, I'm looking for a referral. Can you help me? And when we have that in person, I'm calling Sophia, and I can say, hey, Sophia, Rachel gave me your number, and said that you might be somebody that could help me find another therapist. That's to me like the best place to start.
I agree. I think that a lot of times people can get overwhelmed with the internet and other sources, which are wonderful sources. But if you do have friends and family that maybe have gone to counseling before, maybe they haven't been open about it. But if you just ask and get that conversation started, you might be surprised that they know someone that maybe is even just an acquaintance of theirs that might have a connection with a therapist or something, and they could say, oh yeah, I know this person, they're a good person, check them out, try that route first. As therapists, I think it is so important for us to have a large referral network and sure that we have already done our due diligence and we have kind of vetted the therapists that we refer to, and we know that they do pretty good work. We're not going to refer to someone if we feel like they wouldn't provide ethical, professional care to someone. And so we want to make sure that everyone that we talk to, even potential clients, are taken care of. And so that's a great resource.
Yeah, and that, when, like, as clinicians, and when somebody calls us, we're going to start the conversation by just kind of getting to know you, even if it's like a 5-10 minute call. And from that, and from what's coming up, then I'm going to go through that, you know, resource list in my head of clinicians that I know, that I work with, um, that I know their specialties. And I can say, okay, like, you know what? I know 50 awesome therapists, but for you, with what's going on, these three people are going to be the first people that I would recommend that you'd call. And that can also include, you know, when it comes to what's your price point for therapy, if you are utilizing insurance or if you're trying to go out of network.
Right. Yeah.
So I think from there, the other thing that you and I were starting to talk about too is really like that affordable therapy piece.
Hmm.
And I was having a conversation yesterday with another woman who works in like health and wellness. And one of the things that she didn't realize is that there's so much that it takes in every state to become a licensed mental health provider. And there are so many different types of us. And within that, I'm currently an associate. So that means I'm in the process of completing my 3,000 hours of clinical to be able to then take a giant state licensing board, wait probably 9 months with how slow things go to actually get that. And then
Right.
I can have all those letters at the end of my name. Well, that's the case for most of us, right? And if you can call somebody and say, hey, look, this is what my price point is. I can afford, you know, $20 for a session. I can afford $75 for a session. I can afford, $150 for a session. There are so many different people within that spectrum and where they are at in their licensing that can that can slide significantly more.
Hmm. Definitely. I think that that's a really big factor as well, because there are so many people who are impacted by this current pandemic that may be needing some help and needing a sliding scale, and maybe even some pro bono work, which I know some networks that have popped up on in each state. I know in
Yeah.
Arkansas, we have one that's reaching out to people that are affected by this to provide
Mhm.
a small amount of pro bono work, as far as like you get 4 or 5 sessions, and then because it's very brief work, just to make sure that people are feeling safe and okay and have somebody to fall back on, because this is stressful for everyone. And
Yeah.
so they're wonderful therapists that are providing their services for free. And
Mhm.
so resources, we can actually list some of those in the comments and sections below, and I'll post some
Yeah.
of the links and resources for people to find that. um,
Give
I,
an hour is a huge one too. I'm not sure if that's one of the ones you're referring to. It's called Give an Hour.
an hour.
And
Okay.
so that's free therapy.
Uh-huh.
And I'm pretty sure it's national. It might be international, but don't quote me on that one.
Okay.
And specifically for first responders and those that are uh, impacted, like, and on the front lines in that way, providing counseling services for free for those individuals.
Right, right. I know that we have, going back to the fact that we might have a large referral network, but
Mhm.
only a couple people might be a good fit because we know they're
Yeah.
special. That goes back to knowing that, as a therapist, it's important for us to know our boundaries too, and we
Mhm.
know that. And if you've done your training and you know your scope of practice, it's really, we don't just take everybody. We're
Mhm.
not a good fit for everyone, and it's okay for people to understand that whenever they're starting with a therapist, that
Mhm.
you're not always going to be a good fit with everyone. And so it's okay for them to ask questions. It's okay for
Mhm.
them to say, hey, I feel a little uncomfortable in this situation. Is there something that I'm missing, or is there something that we need to
Mhm.
change? Or do I need a different therapist? And it's important to
Yeah.
talk about that. Um, every time I meet with someone, I talk to them about the resistance phase. And I talk to
Mhm.
them about how sometimes we say something and it triggers something inside them. Maybe they say something and it triggers something, but it, it is very much a natural phase of therapy where
Mhm.
they might feel like, oh no, I don't want to see that person. I don't want to talk to them. But it's so important to talk about it and say, okay, I'm feeling this way. Is this something that meaning that we're on the right track and we've just hit a little bit of that resistance? Or is it that we're not a good fit and we need to possibly look at referrals? And
Mhm.
hey, and that should be open dialogue within therapy. It should not be something that you feel uncomfortable to bring up to your therapist. So if
I
you're
love that.
that, yeah.
I talk a lot about how finding a therapist is like dating. And you've got to like get to know the other person. You're asking some questions, trying to like listen into that like gut instinct of like, does this feel okay for me or does it not? And
Mhm,
we don't always have the privilege to do that depending on, the different situations. Sometimes we're whether you're assigned a therapist or whatever it is, but taking all of those things into account of it takes a little while
mhm,
to connect with somebody and to see if this really feels right and explore like is it that resistance? Is it that, you know, my stuff is coming up or things that I don't want to look at or this therapist is triggering something in me.
mhm,
And is this the person for me to work through it with? Or is
mhm,
there just something that's just not meshing? And that's
mhm.
okay too.
Yes, the whole fact that is this therapist triggering something? Usually, I talk about that being that the fact that we are on the right track because
Mhm,
if we're starting to trigger something and we're in that resistance phase, and if we just stop and we decide, no, we want to refer or go somewhere
mhm,
else, what happens is it's a roadblock and you hit
mhm,
the same roadblock with everyone because you can't get past this resistance to the working
mhm,
phase. And so I want people to just be aware of that whenever they first start counseling. That's part of my
mhm,
consent so that they understand this process and aren't alarmed whenever because it can be very uncomfortable to get that urge to run from it or the
mhm,
urge to say, no, I'm fine. I don't want to do this.
mhm.
Or just like feeling like they just don't mesh with the person at all. And they
Yeah.
don't, yeah. And so I think it's really important that they understand that this is a
Mhm,
process. Um, that's first step that you talked about, talking with your friends and family,
mhm,
that sometimes relieves it a little bit because they may have a common connection where they're like, "Oh, this
mhm.
person trusts them, so I can trust them a little bit too,"
Yeah.
and so that helps a little bit with that stage, but it's still a natural process, and it does happen with every therapeutic relationship.
Mhm.
It looks different for most people, but yeah.
Yeah. Um,
So we touched a little bit on the um, pro bono work that some of the therapists are doing in different
mhm,
some that's international, some that might be just nationally or statewide. I know we have several that are statewide in Oklahoma and Arkansas, and
mhm,
I think that that's important too because a lot of times we have therapists that might be licensed in the state that you're in, but if you try to get counseling through a telehealth service that the
mhm.
person isn't licensed in the state that you're in, then you might run into that roadblock of you can't actually
Yeah.
see the therapist that you want.
Yeah.
So,
That's a huge thing to remember, and that I think as clinicians is coming at more and more because when we're doing in-person therapy, I know where you're physically located,
mhm,
right? But when it comes to telehealth, I can only provide therapy in the state which I'm licensed, or for you, the multiple states you're licensed. Um,
mhm,
and if you're going online and you're doing teletherapy, maybe it's through something like Talkspace or BetterHelp, they're going to match you with somebody that's in your state.
mhm. Yes. And a lot of times individual counselors will offer telehealth.
Mhm,
I know right now everybody's offering telehealth and that
mhm,
I'm aware of that in my network. But before that, in Arkansas, you had to have a specialty license to offer telehealth, and so it may not always be a resource. But
yeah,
just looking for counselors in your local area is a good way to find that connection and be able to see, okay, is there telehealth options available, or are they seeing face to face, and what are their safety precautions that
mhm.
their clinic is maintaining right now?
I didn't realize that because in California, you can provide telehealth. You just need additional insurance, specific insurance for telehealth. And there's some different protocols just in terms of consent and disclosure
Yeah.
around telehealth. So that's really good that's such great information for me. So
Hmm.
thank you.
So Arkansas is different that way. Oklahoma is very similar to California's. You don't have to have a specialty license. You
Mhm.
just have to have some training if you are going to do it. But that they don't regulate it at all. And
Yeah.
if you're licensed in the state, you can provide it in the state. So each
Yeah.
state is different, and it's important um, for therapists to communicate that to their clients too, because
Mhm.
in this issue, we also have counselor or clients that maybe are traveling to their home states if they had originally been, in your state for a short time or even for other
Yeah.
reasons. If they were a transplant and they had to go back home for some reason during this pandemic, they might not be able to be continuing their services with you. So finding referral sources for them locally is important for them, us as counselors to be able to help them with that.
Yeah. Um, so I think kind of going off of some of what we were talking about with the pro bono, right? So
Mhm.
there's Give an Hour is an awesome resource. You can literally just type in Give an Hour. There's also so many, what are they called? Not databases. Like what's Psychology Today called? It's not a networking.
Advertisements.
It's like a yellow pages for therapists.
Mhm, mhm. Yeah.
So there's also that's kind of like when you type in looking for a therapist on Google, Psychology Today is probably like one of the first things that comes up.
Right.
And that's always a good place to start as well,
Mhm.
to just get an idea of who's close by, who's in my state, because you've got to put in either your uh, zip code or postal code, and then or like where you're looking for therapy.
Mhm,
And
mhm.
right now, with what's going on with everybody working from home and doing telehealth for the most part, at the very top of the profile, it'll tell you, like before you even click on it, if somebody's doing teletherapy, which is super helpful.
Oh, yeah. I didn't realize they were doing that.
Hmm.
That's awesome. I know, other databases or online advertising companies are, are offering some free services as far as, allowing therapists to enroll for free, so that they can actually get their name out there for the telehealth stuff. Some of those pro bono websites like the,
Hmm.
Give an Hour and things like that. We also have, options to have the people go directly to the state website,
Hmm.
um, and they can search for counselors in their area that way as well.
Yeah.
And that way they also know that they can check their licensure and see what their scope of practice is as well.
Hmm.
Well, it has, when they were licensed and, how they can go about contacting them, things like
Hmm.
that. And they also have that in Oklahoma. So,
Oh, that's great. Is that through the Board of Behavioral Sciences?
um, the one in our Oklahoma is called the Oklahoma Behavioral Health Board.
Okay.
Yeah. And the one in Arkansas is the Arkansas um, Examiners of Counselor or
Okay.
Counseling Examiners. Yeah.
Okay.
I can't believe I can't remember my board's name.
Yeah. In California, it's the Board of Behavioral Sciences. So you can like go online and you can verify the
Yeah.
license. And
Mhm.
I know on Psychology Today, there'll actually be a little thing that says verified, and that's
Mhm.
if they've checked it with your state board.
Right.
Uh,
Mhm.
the other like database I really, really like, have you ever heard of Therapy Den?
I have not.
Okay, it's super small, um, especially in comparison. But what I love about it is if you're looking for a therapist that is sex positive, LGBTQ affirmative, is well versed in maybe immigration issues, really on top of social justice. Therapy Done in particular has a huge emphasis on that. So when you go through profiles, you can look for those specific things that maybe when you're looking kind of generally, whether it's through Google or you're asking a friend or you're on Psychology Today, it isn't as specific with some of those marginalized groups. And
That's all.
so for anybody that, feels like they've struggled with finding a therapist that understands them because of stigma, to me
Mhm.
that's like my go-to. You can read all about their philosophies, you can read about their social advocacy, what's important, and
Right.
you'll be able to see very, very clearly, what their experience is with the different marginalized populations.
That's neat. And it's Therapy Den?
Yeah,
Okay.
and then
So
yeah.
when someone's looking online, we talked about how they can actually find someone and then verify their credentials if it's
Mhm.
not through something like Psychology Today that has already done that, which is nice
Yeah,
because it takes some of the legwork out for them, right?
yeah.
Mm. They also have options to ask their friends and
Mhm.
family. They
They can go through their state,
mhm,
like
the
going
state.
through the state website.
Yeah, of course, Google. I mean, just Googling, like, Google My Business has a lot of things. So, like, whenever you
Mhm,
Google a therapist near me, that pops up sometimes a big list of therapists,
mhm,
and you can find therapists that way as well. And most of the times they're cross referenced, and maybe you
yeah,
could find their website and read on there about, you know,
mhm.
their theories and practice.
Yeah, the other one that I just learned about that I really love, specifically for sliding scale, so getting back to that affordability in this
Hmm.
time of uncertainty, is called Open Path Collective.
Hmm.
And yeah, I mean, I just learned about it and I was so excited. And what it is it's a nonprofit and therapists from all over the country. I know Canada, but potentially some other countries. You can go on, and every therapist that signs up commits to seeing at least one client from Open Path. And so for individual therapy, it's between $30 to $60. Like it won't change. That's what it is. That's what the therapists commit to working with, like to working in as their sliding scale. And then for couples or family therapy, it's between $60 to $80 in the sliding scale.
Okay, that's awesome.
Yeah,
Yeah, and that's nationwide as well.
that's
Or
nationwide.
yeah, so that's awesome. Um, so what could we do to encourage people during this time if they're struggling to find a therapist? What can we do to kind of help encourage them in that way?
Going to therapy does not mean that there is something totally and completely wrong with you.
Right?
Therapy means like, I just need some support, or I'm on this journey of I want to understand myself more. I want to do better in my life. I want to feel better. And that's more than enough reason. Like, that's an incredible reason and motivator. With the current situation that's going on right now, there's so much uncertainty, right? And this fear, anxiety, all of that is bringing up times where we felt that way before. And so
Yes.
for a lot of people, being in doing the social distancing, being in what feels like a quarantine or, whatever it might be, is bringing up so much of our own stuff that it's actually really normal right now for to be feeling and to be spending the time maybe thinking about what's going on with yourself more because there's the time and a lot of us are alone.
Hmm. Yeah. Less distractions.
Yeah.
And it's not always helpful for us to sit with ourselves sometimes if we're doing that alone. So having someone to talk to can actually help us get through this a lot easier.
Yeah. And to find the ways that are going to be most effective for us cope. 'Cause, like, I don't know about you, but I'm on social media and there's all of this. Somebody phrased it so well for me the other day and they called it toxic positivity.
Hmm. Yeah.
I said, that resonated with me.
Hmm.
We are doing the best that we can, and you do not need to have a perfect quarantine, a perfect like pandemic experience. We are literally in a pandemic, and putting one foot in front of the other is all that you can do.
Yes. I think I did a little slideshow on that. The fact that mental health, um, survival tips on just cooking,
Hmm.
eating together, cleaning, resting. Those are all doing things. Those are all
Yeah.
productive things. And it's all things that we can do to protect our physical and mental health.
Hmm.
And it's just daily things, making sure
Yeah.
that we get out of bed, we rest. If you want to read, read a little bit. If you want to just sit around, do whatever you can to take this time to rest and heal from
Hmm.
all of it because we are in a crisis. And this is a situation where you don't have to be producing something outside of yourself to be productive because
Hmm.
rest is being productive. Doing nothing is doing something in that moment. And because our bodies need that, and we
Hmm.
sometimes need that to slow down and be able to heal from that. So it's
Yeah.
okay to have I think somebody had said something about coming out of this with a new business or a new skill or something like that. And that's okay if you feel the urge and motivation to do that. But if you don't, that's okay too. You don't have to spend the time learning something new or doing something different with yourself
Yeah.
because it is doing something to rest. And we do need
Right.
that. We
And
need to survive.
resting doesn't mean that you're lazy. Like there was a whole like meme or something that went around that was like, if you don't come out of this pandemic with, a new skill, a new business opportunity, or something else, it's not that you don't have time, it's that you're lazy. Like that's not true.
No, it's not true.
Nothing about that is true. If you do have the opportunity to use this time and for you that's effective, great. If you're also just trying to figure out how do I get through the day,
Mhm.
like that's okay.
Yes. Mhm. Yeah, we're just trying to survive this and be
Mhm.
able to come out of this so that we can thrive later. And that's what we have to remember is that we need to sometimes just look at it a little bit differently and not
Mhm.
be pressured by all the things that are out there telling us their opinions of that we're lazy or we're doing these
Mhm.
things. We don't have to be that way. Just rest and spend, if you have your kids home with you, spend time with them. That's you start to notice that you are feeling a little down. If you're starting to feel like less motivation to get out of bed, less motivation
Mhm.
to cook and do your daily living activities, that might be a good time to reach out to someone and say,
Yeah.
hey, I'm having a hard time with this. And it doesn't have to be a therapist. We're all in
Mhm.
this together. We are all
Yeah.
going through this at the same time. So reaching out to family and friends and staying connected. That's one of those
Mhm.
others that I had on that list was just making sure that we have people to talk to and we're not alone through this because that's going to be the hardest thing is being alone through this.
Mhm. Absolutely.
Yeah. Well, thank you so much for joining me today and
Thank
talking
you.
about how we can help people find a good therapist.
I
Yeah.
appreciate you inviting me to be a part of this. And I appreciate the work that you're doing to really help get this message out that mental health support is accessible. And taking care of your mental health and your mental wellness isn't just go see a therapist. It's this body, mind, soul. How do I feed myself? What kind of structure? How do I stay connected?